So for today, we'll be discussing the iontophoresis. Okay, so some of the contents were also provided by Sir James. Okay, so kaya nandyan siya. Alright, so for your iontophoresis, no, this has been a successful treatment for numerous conditions. No? Basically, your iontophoresis is the use of electrical current to promote transdermal drug penetration. Okay, so yun lang naman siya. Alright, commonly used in rehab, okay, would be the application of corticosteroids or your dexamethasone. Okay, so si iontophoresis, no, it uses, okay, a continuous unidirectional current or your DC or current, direct current. Alright, so that the ion transfer may occur. No? So kung maaalala ninyo in our introduction to electrical currents, alright, ito yung kung saan we have utilized yung theory na like, repel like. Alright? Like, repel like. So, the ions, okay, yun yung ating medication, no? So, like for example, yung dexamethasone, meron siyang kumbaga meron siyang polarity, okay? And yung ating electrodes din, meron din silang certain polarity. So, kailangan magkapareha sila so that they would repel each other and that would facilitate the drug penetration furthermore into the skin. Okay? Instead na i-absorb siya ng mismong electrode. Okay? So, yun yung pinaka-principle ng ating iontophoresis. So, most studies have demonstrated penetration to a depth of 3 to 20 millimeters. No? Around 3 to 20 millimeters. So, it varies on the drug na ina-apply natin, no? So, according to your Cameron, no, sodium ethanolamine and lidocaine could be detected up to 2 centimeters. Okay? So, medyo malalim yung kaya niyang ipapenetrate in your lidocaine. Okay? Next natin. So, forces acting to move an ion. No? So, paano siya mamumove? No? Aside from the general approach of like, repel like, paano ba talaga yung ion na push further into the skin? No? So, there are actually two forces. Okay? Your strength of electrical field, okay, and impedance of the body, the current flow. No? Syempre, we all know that skin has a certain resistance, okay, to electrical current. So, kailangan malaman kung lesser ang resistance ng skin, okay, that it could easily penetrate further into your skin. Okay? So, kung tutuusin, no, in your impedance of the body to current flow, no, we can compensate for skin impedance, no? If ever medyo mataas ang resistance niya, okay, we could alter the current amplitude that we give, okay, just to be able to lower that certain resistance. Okay. Velocity of the charged ions. It is actually the current density, okay, it is the current density at the electrode body surface interface that is responsible for the velocity of the charged ions as they pass into the body. So when we say velocity of the charged ions, kaano ba sila kabilis, okay, nagpe-penetrate into the skin? So it is actually depending on the current density. No? And as we all know, your current density, this can be increased either, no? Ang current density nyo can be increased either by decreasing the size of electrode, okay, para mas concentrated yung current, yung energy, okay, or increase the current amplitude. Okay? So, dalawa lang yung pwede nating i-modify to be able to further enhance the velocity of the charged ions, in which we are directly modifying the current density. Okay? But what's the principal guide to current density? Kasi hindi naman natin po pwedeng, kumbaga, what would be the limit? Okay? Yun yung tanong dito, no? Principal guide to current density. What would be the limit? It would be the patient's comfort, no? Merong ibang patient kasi, as we have mentioned before, no, meron silang certain level of threshold for pain. Okay? May iba na ang current amplitude nila, kaya lang nilang mag-tolerate ng low levels. Meron namang iba, high levels kaya. Okay? So, it would really depend in your patient's comfort. No? So, usually, ang pinakamadali kasing i-modify between the two, no? Kung gusto mong i-change or i-modify ang mismong current density, between those two, decreasing electrode and increasing amplitude, mas mabilis yung increasing amplitude kasi pipihitin mo lang siya. Whereas, you're decreasing the size of electrode, no? Kailangan pang palitan mismo yung component. Okay? Physiological effects of direct skin, no? So, ano yung mga physiological effects? It depends on what kind of electrode we are using. Pwedeng anode or cathode. Okay? Pag kasi anode is a positive charge. Okay? Positive charged electrode. Okay? Your cathode naman, siya naman yung negatively charged electrode. No? So, may palatandaan tayo dyan. No? Sana makapag-sulat ako dito. No? Ayan. So, sulat tayo sa net. Okay? So, may palatandaan tayo para hindi kayo malilito kasi medyo nakakalito siya dahil inyong anode is positively charged, negatively charged yung cathode. Pero when we are talking about ions itself, no, meron tayong anion and cation. Okay? So parang medyo tunog lang siya dito sa electrodes natin. But then your cation is positively charged kasi siya. Okay, cation, these are ions that are positively charged. In which, no, sa ating iontophoresis, ang magka-pair would be your anode tsaka yung cation. Kasi parehas silang positive, no? Kasi kailangan natin yung like repel like. Okay. Para lang hindi kayo malito because ang partner naman ni cathode would be the anion. Kasi parehas silang negative, no? Negatively charged electrode and negatively charged ion. Okay. So, ito yung magiging mnemonics ninyo. Panic. Okay? Ano ibig sabihin ng panic? Okay. Positive is anode. Okay. Negative is cathode. Okay. Mali spelling. Yeah. Okay. So, panic. Okay. Positive si anode. Negative si cathode. No? Madali na lang pagka sa ions. No? Baliktarin nyo na lang. Cation would be yung positive. Okay? An ion would be yung negative. No? So, at least, ito, yung mismong electrode. Okay? Para di kayo malilito, no? Electrode. No? Parehas silang ODE yung huli. No? So, when we talk about anode and cathode, we are talking about electrodes themselves. When we are talking about ions, it's your anion and your cation. No? So, para lang hindi kayo malito with the polarities. Okay? Ayan. So, there are certain hazards with the anode and cathode use. No? Kasi they have certain reactions. Alright? Pag si anode kasi, we have acidic reaction. Okay? Acidic reaction. So, ano yung nangyayari with your acidic reaction? Okay, in your acidic reaction, there is hardening effect. Okay, paki-take note kasi wala to sa presentation, no? Meron siyang hardening effect and it produces mild heating effect due to the vasodilation. Okay, ulit tayo. Alright? Acidic reaction for anode. Okay? There is hardening effect and produces mild heating effect due to vasodilation. Okay? Kabaliktaran naman kay cathode, no? Ano ba ang opposite ni acidic reaction? It would be your yes, your alkalinic reaction, no? Si alkalinic reaction naman, kabaliktaran naman yung mga reactions niya. Okay? Kung sa anode, which is acidic reaction, hardening effect, kay cathode, which is an alkalinic reaction, softening effect naman siya. No? Softening effect. Pero, meron din siyang mild heating effect. Okay? Yan, mild heating effect, no? Those are the usual reactions. Okay, your acidic and your alkalinic reaction. Ano yung sinasabi nating hazards doon? Okay? Ano yung hazards dito? In your alkaline reaction, unahin natin si alkaline muna, no? Kay cathode muna tayo. Okay, cathode. In your alkaline reaction, no, under this negative electrode, it can cause discomfort, skin irritation, or chemical burns. Okay? Discomfort, skin irritation, or chemical burns. No? Yung anode, however, which poses acidic reaction, okay, mas quite safe siya. Okay? Because it's less uncomfortable than the alkalinic reaction. No? Wala ka masyadong makita na magkakaroon ng chemical burns, skin irritation, and mas lalo na yung discomfort. No? Mas madalas siya under the cathode. Okay? So, if ever you will be applying iontophoresis to your patients, no, you might want to orient them with that. No? Lalo na kapag ang gagamitin nyo talaga sa kanya is cathode. Okay? Dahil ang medication ni patient would be containing a negative ion. Okay? Ay, negative ion tuloy. Tama ba? Positive is anode. Negative is cathode. Tama. Ayan. So, the continuous direct current, this is the current choice for iontophoresis, no? Nandun naman na sa mismong word. Okay, continuous direct current. Bakit kailangan natin yun? Okay, to be able to penetrate talaga, kailangan continuous yung current and it should be direct. Okay? However, meron siyang certain hazards, no? There is a possible formation of electrochemical burn on the skin underlying electrodes. Okay? If there's an alkaline, like for example, no, alkaline reaction under cathode, no? Although medyo napahapyawan na natin to from the previous slide, this is more caustic, no? Especially your sodium hydroxide. Okay? Acidic reaction naman occurring under the anode and less caustic, no? Usually hydrochloric acid. Okay? Ayan. So, to prevent skin tissue destruction, no? Ito yung mga pwede nating gawin para lang hindi masyado ma-irritate yung skin, wala tayong makitang walang discomfort kay patient or less, if ever, no? The current density should be not more than 1 milliampere per square centimeter. No? Dapat daw yung current density yon, no? Kasi later on makikita nyo meron tayong amplitude na gagamitin and it's more than 1. So wag malilito. Okay, we are talking about current density here. So you might be required to do some math para lang ma-determine nyo kung yung amplitude na yon would result to a current density of less than or greater than 1 milliampere per square centimeter. Okay? Size of electrode, no? So, it is somehow related with the current density, diba? Ang current density natin nag-i-increase as we as we tend to decrease the size of the electrode. So if you want to prevent skin tissue destruction, you would have to use a larger size of electrode. Okay, current intensity, yun din, kasi both of them, no, are actually affecting the current density. No? So, kumbaga, they are like kumbaga supporting details sila ng inyong current density here, no? Both of which, no, ang pinaka objective is dapat hindi exceed ng 1 milliampere per square centimeter. Okay? So, ang rule of thumb natin, no, the surface area of the cathode should be at least twice that of the anode at all times. No? Surface area daw ng cathode should be at least twice that of the anode at all times. Bakit? Okay? Kung maalala nyo sa previous slide ulit, no, mas nagkakause ng discomfort si cathode. Okay? And therefore, kailangan mas malaki yung surface area ng electrode niya. Okay? Para maiwasan yung mga discomfort, skin irritation, or any kind of hazards. Okay, si anode kasi hindi siya masyado, it's less caustic. Okay? So, hindi siya masyado, kumbaga, hindi siya masyado magiging problem. Okay? Si cathode, ito yung magiging rule of thumb natin, kailangan medyo mas malaki siya. Okay? Kasi ito, mas nagkakause siya ng discomfort to our patients. Okay, therefore, no, what does this mean, no? Bakit kailangan twice ng laki? Does it mean, ma'am, na mag-a-apply pa rin kami ng, mag-a-apply pa rin po ba kami ng anode electrode kahit na meron kaming drug doon sa cathode electrode? Yes, no? Kapag mag-a-apply kayo ng electrode, palaging in pairs, no? To complete the current. Alright? To complete the current. So, therefore, no, si anode, okay, ang mangyayari kasi, no, we would have an active electrode and an inactive or dispersive or indifferent electrode, no? Pwedeng alin dun sa tatlong yun yung tawag nyo sa kanila. Ibig sabihin, yung isa may gamot. Okay? Yung isa, ilalagay nyo lang somewhere sa body para lang makomplete yung current. Okay? Para lang makomplete yung current for the sake of completing the current. And that's it. Okay? So, if ever ang gagamitin nyo is anode electrode, may cathode electrode kayo na i-attach. Okay? Like for example, no? Ang a-applyan nyo would be deltoids. Okay? So, yung active electrode, kunwari is anode ang kailangan nyo na electrode. Anode, nasa deltoid. Tapos si cathode, no? Ilalagay nyo lang siya a bit near to it, no? Pwedeng upper traps, no? Just to be able to complete the current. Okay, para lang ma-complete yung current. Yun lang naman. Okay, and ito ang ating rule of thumb, huwag kakalimutan, no? Dapat mas malaki si cathode than the anode. Okay? Yes. So, ito lang medyo tatandaan natin, no? Because the iontophoresis, no? Merong mga certain drugs that has anesthetic effect. Okay, it has anesthetic effect. No? So it means that the patient may be totally unaware of the development of electrical burn if ever meron. So, therefore, to prevent that, you should check the skin prior to application and during treatment because the direct current and the small electrodes used for your iontophoresis produce a high current density, okay, which increases the risk of burning the patient. And therefore, babalik tayo sa hazards kanina, no? Ito, i-observe talaga natin. Okay? Talagang kailangan strict tayo with the compliance of this. Okay? Kasi nga, merong anesthetic effect ang ating iontophoresis. Okay? Yan. Merong anesthetic effect ang iontophoresis. Tapos, meron pa siyang mild to moderate hyperemia on both electrodes. So, ibig sabihin, kahit inactive yung isang electrode, no, pwede pa rin magkaroon doon ng hyperemia. Okay? when we say hyperemia, na medyo, kumbaga, medyo namumula or medyo mainit yung area. Okay? Ayan. Okay, transfer of ions, no? The effectiveness of a specific ion will depend upon, okay? Yan, the number of ions transferred, no? Madami ba yung gamot na nilagay mo? Konti lang. Okay, kasi ito, subject pa rin siya for the law of optics. Okay? The depth of penetration. Okay, kung na-deliver nyo ba siya or there was a transdermal drug penetration na enough for that drug. Whether the ions combine chemically with other substances in the skin and precipitates. Okay, ibig sabihin, mag-separate out siya as solid. Okay, and whether the ions enter the capillaries carried away from the site of application by the blood. So, itong mga to, ito yung mag-a-affect ng effectiveness of a specific ion or the specific drug. Okay? So, like for example, no, you are delivering a lidocaine, which is dapat meron siyang local anesthetic effect. Okay? Pero, pwedeng reduced yung effectivity niya kasi it could be that the ion entered the capillary and instead na induce ka ng anesthetic effect on the local area, no, it was carried away from the site of application by the blood. Okay, so ito yung mga certain factors that could affect the effectivity of your drug. Yeah. The number of ions transferred into the human body is related to, okay, ayan. So, this is another factors, no? The current density at the active electrode, the duration of the current flow, and concentration of ions in the solution. Okay? Ayan. Therefore, no, the number of ions transferred into the human body, okay, would definitely be affected by these. No? So, aside from kanina, no, kanina kasi effectiveness. Okay? Kanina is effectiveness of a specific ion. Pero, one of the factors here is the number of ions transferred. So, medyo inelaborate natin yung part na number of ions transferred. If you want to efficiently transfer a number of ions, no, kailangan ito yung factors na titignan natin. The current density at the active electrode, duration of the current flow, concentration of ions in the solution. No? Sa duration kasi, no, however, nasa duration, kapag medyo mas matagal, okay, as the duration of the treatment increases, the skin impedance decreases. Okay? Although, that would mean na yung current, no, mas magkakaroon ng penetration, transdermal drug penetration, but it will more likely to cause burn as well. So, hindi natin siya masyado hindi tayo masyado magli-lean towards a increased duration of the current flow. Okay? So, the quantity of ions introduced across the body surface is directly proportional to the current density. Okay? Therefore, longer duration of current, okay, we would have higher current intensity. Okay? Quantity of ions introduced across the body surface, directly proportional daw siya to the current density. And we wouldn't want a too high of a current density. Therefore, no, yung longer duration of current and higher current intensity, okay, both of which could increase the current density, medyo i-monitor natin siya. Okay? Factors inhibiting the transfer of ions. So, kanina, medyo pro yung ating pinag-uusapan. Ito naman yung mga pwedeng maka-withhold of the transfer of ions. No? First is the skin. No? One of the primary function of the skin is actually to increase the impedance to current flow and to ion transfer. No? Kumbaga, meron kang resistance dyan talaga sa skin. And kanina, ang sabi natin, to address that, you would only have to modify the current density. Okay? Yun. So, what part of the skin decreases ang impedance? Okay? So, what part of the skin decreases impedance? No? It would be the dermal structures. Okay? Such as the hair follicles and the sweat glands. So, if you are applying iontophoresis to an area kung saan ma-hair and medyo sweaty, okay, that would mean that there is a decreased impedance on that area. Ibig sabihin, hindi ka mahihirapan mag-transfer ng ions doon. Okay, hindi ka masyado mahihirapan mag-transfer ng ion. But, you have also greater chance of developing burns. Okay? The tendency of some ions to form insoluble precipitates as they pass into the tissue. Okay? So, yan din. Isa rin yan sa problem natin. No? The tendency of some ions to form insoluble precipitates. No? Ibig sabihin, they kind of separate and turn into solid. Okay? As they pass into the tissue. Okay? Ano ba na-form yung precipitates na yan? Okay? These are actually formed, okay, with the transfer of heavy metal ions. Okay? Ano yung mga heavy metal ions natin? They're iron, silver, copper, and zinc. Okay? Yan. Iron, silver, copper, and zinc. Okay? Ang medyo maganda is the ferric ions. Kasi they can penetrate the skin to the depth of the dermis. Wala tayong problem with the transfer of ferric ions. Okay? So, tandaan, yung heavy metal ions na yon, iron, silver, copper, and zinc. Sila yung madalas, sila yung mga madalas na mag-form ng precipitates. Okay? Kasi yung mga heavy metal ions din kasi na yun, sila yung madalas din na content ng ating mga drug. Okay? Yan. So, those are some of the factors that may affect that may inhibit the transfer of ions. Okay? Okay. So, current amplitude and treatment duration for iontophoresis treatment. Okay. So, ang dosage kasi natin would be milliampere minute. Okay, should always be equal to 40. Okay, 40 milliampere minute. So, if ever meron kayong pwedeng i-modify, okay, it would be the treatment time and the current amplitude delivery. Okay, so the current amplitude is in milliampere unit and the treatment time is in minute naman. Okay, if you are going to deliver current amplitude of 1 milliampere, you would have to deliver the treatment for 40 minutes. Okay, so palaging ganyan lang siya. Or like for example, no, si patient, ang kaya niyang i-tolerate na current amplitude, okay, would be 2 milliamperes. No, actually, ito yung pinaka okay gamitin. Okay, siya yung most recommended parameter. No, 2 milliampere, that's 20 minutes ang treatment time. No, mas safe daw ito. At saka mas, kumbaga mas optimal yung result na nakikita when you apply this parameter. Okay? Yung dosage natin palaging 40 lang. Okay? So, if you would want to modify a parameter for the iontophoresis, ang iibahin niyo would be treatment time and current amplitude. Pero dapat re-result sila into a 40 milliampere minute. Okay? Kumaga, ipag-multiply niyo lang yan. Okay? Ipag-multiply niyo lang. At kailangan ang product nun is 40 milliampere minute. So, that would be for the dosage. Let's go to the ions mismo. Okay, ions and parameters used clinically for iontophoresis, no? Pakitandaan ito. Talagang tinatanong to from exam, our shiftings, and most definitely boards, no? Hindi mawawala ang iontophoresis, especially this one. Okay? Meron tinatanong dyan. Okay? First, your acetate ion. The acetate ion coming from the acetic acid, which has a negative polarity, okay, is indicated for calcium deposits. Okay, if you have calcific tendinitis, okay, you would have to use the acetic acid. Okay, and since ang kanyang polarity is negative, you would have to use the cathode. Okay, ayan. Tapos we also have chloride, negative siya. For sclerotic naman. Okay? Copper, positive naman siya. This is for your fungal infection. Next sa metason phosphate or your decadron. No? Medyo kailangan maging familiar kayo both with the ion and the source. Okay? Either kasi dyan yung tinatanong. With your decadron naman, pwedeng positive, pwede ding negative. Okay? Inflammation or itis. Yung mga itis natin. No? Yan, pwede siya. Next sa metason. No? Anyway, this is a corticosteroid. No? Hyaluronidase or your iodase. Okay, polarity is positive and this is more for edema reduction. Okay? Iodine or potassium iodide. No, this is negative. Ito naman for scar. No? Especially mga bagong or forming pa lang na mga scar na maganda siyang i-apply. Lidocaine positive, this is indicated for local anesthetic. Magnesium positive, muscle relaxant or your vasodilator. Okay, salicylate, okay, positive or negative, no? Silang dalawa. Okay, dexamethasone, salicylate, and your tap water. Okay, yan, silang tatlo. Iba-iba ng polarity. Tap water or your silocaine, alternating polarity. And this is indicated naman for hyperhidrosis. So, si Sir James, no, may tinuro siya sa amin dati na tandaan. Ang dami. So, for the negative daw, no, para hindi ka na mahirapan, ang ginamit niya was nasad ka. Di ba pagka masyado tayong negative about life, masyado tayong nasasad. Okay? So, nasad ka. Puro daw to mga negative ions. Okay? Ano yung nasad ka na yan? Okay? Yung Na dito, this is for the sodium. Asan na yun? Sodium. Okay? Sodium chloride, ito. Okay, negative. Kailangan nyo na lang tandaan yung indication. Wala tayong mnemonic for the indication. Pero at least, no, medyo meron ka ng chance sa pagsagot, no, pagka alam mo na yung polarity niya. Okay. So, Na, sodium. Yung SAD, no, yun yung mga starting na letters nila. So, for the letter S, okay, it would be your sodium salicylate. No, your salicylate. Negative. Salicylate. Yung it would be acetate. Okay. Diba? Next step is and last. Okay, no, wala kami kitang starts with letter K dyan. But, diba, yung ating potassium, okay, yung potassium natin sa periodic table, diba, it is represented by letter K. Okay, so potassium iodide yan. Potassium iodide, also negative. And all others, no, pagka wala ka sa nasad ka, it would be a positive ion. Okay? So, aralin nyo yung mnemonic na yun, no? Hindi naman siya mahirap kabisaduhin. Okay? Now, let's go to the contraindications. Okay? Contraindications for the use of iontophoresis. Okay? Allergic reactions. Okay? Sensory loss or impairment, no? Kumbaga, una pa lang, meron na talaga siyang sensory loss. Pero yung nagkaroon siya ng sensory loss dahil sa iontophoresis anesthetic effect, that's normal, okay? Pero ito, pagka-umpisa pa lang, meron na siyang sensory loss, contraindicated siya. Okay, over denuded area, so over new scar tissues. Okay? New scar tissues. Okay? Ibig sabihin kasi noon, underneath, no, although it's closed na yung wound, underneath, it's still undergoing repairs. Okay? So, we wouldn't want yung mga tissues na yun na ma-disturb. Okay? However, no, if it's for addressing the scar itself, okay, pwede si potassium iodide, no? Maalala niyo, potassium iodide. Pero like for example, no, you would want to address edema reduction. Tapos, meron kang nakitang new scar, no? Huwag mo siyang i-apply doon. Okay, ganun ang contraindication natin. Metal electrodes must never come in contact with the skin. Okay, metal electrodes. Okay, ang electrodes natin, kung maalala niyo, di ba, yung parang goma. Okay, yun. So, kung nabuksan niyo na yung package niyo ng your ES machine, no, kung makita niyo yung electrode doon, goma siya. Hindi siya metal. Okay. Parameters for your iontophoresis, no, your electrode placement. Drug delivery electrode, okay, is placed over the area of pathology. Yung drug delivery electrode, ito yung active electrode natin. Okay. Iontophoresis with wired electrodes, okay, dispersive or return electrode is placed few inches away from the active electrode. Okay, so it should be over a muscle belly. Okay, over a muscle belly. Katulad nung binigay ko example kanina na yung active electrode nasa deltoids, tapos yung inyong dispersive electrode or inactive electrode, andun lang siya sa traps. No? They are just few inches away. Okay. Okay, size of electrode. Okay. Electrode should be large enough that current density does not exceed. Okay. Does not exceed. Kanina kasi in general tayo dun sa previous slide na dapat para maiwasan daw yung skin destruction, hindi siya hihigit ng 1 milliampere per square centimeter. No, medyo naka-general yun. Ito, in-specify lang natin. Okay? Further specified. Okay? Dapat daw, ang laki ng the size of the electrode should produce yung current density niya not exceeding 0.5 milliampere per square centimeter pagka cathode. Okay? Ang ating active electrode. Okay? Ang ating active electrode. Okay? Tapos, yung sa 1 milliampere per square centimeter kanina na sinasabi, we are pertaining to the anode. Okay, anode. Pag si anode naman ng ating active electrode, dapat ba ang current density hindi mag-exceed na 1 milliampere per square centimeter. Okay, so para medyo mas madali siyang maintindihan, bibigay tayo ng example. Now, for example, ang inyong active electrode would be cathode. Okay? Ang sabi dito, dapat hindi daw mag-exceed yung kanyang current density of 0.5 milliampere per square centimeter. So, for example, ang size ng electrode natin has about 25 square centimeters. Okay? Hindi natin dito. Yung size ng electrode would be 25 square centimeters. Tapos, yung current amplitude, okay, na i-deliver natin is 2 milliamperes. Okay. So, para ma-determine kung applicable ba ito, okay, hindi ba siya mag-exceed ng allowable current density, no, you would have to divide, no? So, milliampere, so 2 milliampere, okay, divided by 25 square centimeter. Okay. Okay, so if i-divide natin siya, 2 divided by 25, no, it's 0.08 milliampere per square centimeter. So, i-check ninyo, no, this is 0.5. Less than that. So, ibig sabihin, safe ito. Okay. safe ito. What if medyo mas maliit, no? Gawin natin 10. Okay, 2. Magiging 0.2. No, pwede pa rin siya. Okay, pwede pa rin siya. Okay, ayan. So, ganyan lang po yung mag-compute, no? So, in your quizzes, no, pag may na-encounter kayo, no, you would just have to perform this simple math equation. Okay? Yung ating simple formula, na hindi naman siya ganun ka-tricky. Right? So, ganun po mag-check if the current density is applicable ba siya or hindi. Okay? Polarity. Okay? The drug delivery electrode or our active electrode should have the same polarity as the active ion of the drug to be delivered. So, if ever deliver ka ng potassium iodide, which is, anong ion? Okay? Which is a negative ion. So, dapat ang kanyang electrode should be cathode. Okay? Dapat cathode. Okay? Dapat ganun. Right? Current amplitude. The amplitude should be determined by the patient comfort and should be not greater than 4 milliamperes. No, hindi daw maganda ang effect kapag greater than 4 milliamperes. So, kaya kanina dun sa table, ang naka-specify lang sa atin for the current amplitude is 1, 2, 3, 4 milliampere. Okay? So, the current must be increased slowly at the beginning and decreased slowly at the conclusion of the treatment. So, ito naman, given naman siya. Kahit anong device, no, when we are modifying the amplitude itself, no, kasi diba, yun yung pinaka-intensity kung gaano kalakas yung kuryenteng marireceive nila, kailangan gradual ang pag-modify. No, kasi yun yung mismong pinaka-mararamdaman nila. Okay, treatment time. The treatment time is affected by the current amplitude. Okay? So, as you all know, no, kanina yung table natin, di ba nga, na-explain natin doon na si treatment time, it would depend on the current amplitude. Kapag 2 milliampere ang gamit mo, therefore, ang treatment time would be 20 minutes. Okay? Kasi kailangan dun siya sa dosage natin, no, na 40. Okay? The time should be adjusted to produce total treatment dose of, na actually in range yun, no, hindi lang siya 40. It could be 40 to 80 ang ating treatment dose. Pero, pinaka-common kasing ginagamit na dosage is your 40 milliampere minute. Okay? So, in practice, one should set the current amplitude to patient comfort and then adjust the time to produce the desired product. So, ibig sabihin, hindi treatment time ang ating concern. No? It should be the current amplitude hanggang saan yung kaya ni patient, and then doon natin madedetermine gaano ka tagal yung magiging duration ng treatment. Okay? Specific utilization of iontophoresis. Okay? For your local anesthetics, no, which is kanina nga, no, we are making use of the lidocaine. Okay? Procedures such as dental. For the dental, no, tooth extraction, pwede siyang gamitin. For the ear, no, your external auditory canal and tympanic membrane prior to surgery. Nose and throat. Okay. In your opta, no, surgery of the conjunctiva. Okay, this is in lieu of injection infiltration. No, kapag di kaya ang injection or hindi prefer ng patient or hindi siya po pwedeng ma-injectionan, okay, you can make use of the iontophoresis. Okay. Next, edema reduction. Okay. Using hyaluronidase iontophoresis, we can reduce edema in acute and chronic conditions. Okay, so pwede siya either of the two. Inflammatory conditions, ito yung mga sinasabi natin kanina na mga itis, no, yung bursitis, tendonitis, ulcer ligamentous strain, and epicondylitis. No, usually, ang ginagamit dito is the decadron o kaya naman the xylocaine iontophoresis. No, either one of those. Okay, so nandun naman, yung dalawang yan, nandun din naman siya sa table kanina. Okay. Next is your skin conditions, no, including idiopathic hyperhidrosis. So, ito, tap water ang gamit. And as you all know, meron siyang alternating polarity. So, wala siyang definite na negative or positive. So, ibig sabihin, either one of the electrodes ang gamitin ninyo. Either anode or cathode. Small open ulcers, you would have to use the zinc oxide. Fungus infections, copper. And then antibacterial effect, silver ion. Ma'am, paano po yun? Hindi nakalista yung polarity ng mga nabanggit na yan, no? Your zinc oxide and your silver ion. No? So, medyo review tayo ng periodic table itself. Okay? Na natin siya ma-determine kung positive ba yung polarity niya or negative. Other conditions. Okay? PVD or your peripheral vascular disorder. RA, your rheumatoid arthritis, and your varicose ulcers, no? All of which could make use of the histamine and meconill. Okay? So, para sila sa superficial vasodilators. Okay? Although dito kasi, no, pagka gumamit kayo ng histamine tsaka meconill, no, it could induce drastic fall in BP, okay, increase in pulse rate, sweating, and flushing of the skin. Okay, so medyo cautious, kailangan maging cautious lang, okay, in applying this. Sclerotic therapy, we would have the iodine iontophoresis or your potassium iodide, okay, for reducing and stretching of the scar tissue. Okay. Calcium deposits, we would have acetic acid. Okay. Ayan. Alright. So, that would be the end of the iontophoresis na medyo maikli lang din talaga siya. Alright. So, you would have, I think, almost 2 hours, no? Kung pinanood nyo to agad ng ating session time. You would have to, hindi pala 2 hours, no? Mga around 1.5 hours to review. Okay, and good luck. Thank you.